So, yeah, what are the biggest challenges people face in withdrawal?
So you could say that there are like at least two sides of it. There's coming off and staying off the drug. Like coming off, the technicalities of tapering, making small dose reductions and stabilizing, and all the science behind a correct hyperbolic taper is one thing. So how you come off the drug without going into too severe withdrawal. The next part is then staying off the drug, which is a different thing, right? Because it means that whatever the drug did to you that was helpful, if it did something that was helpful, which is not true for all, but say that it actually had some kind of effect that either helped you or you've gotten used to. Well, then coming off the psychiatric drug also involves the transition from a numbed mind, or whatever the drug did, numbed emotions, numbed thought activity, less contact with your body, to then again having emotions, thoughts, and bodily sensations. And that transition doesn't look like anything else, in my experience, that we experience in life. Like, it's kind of a unique transition to once again revisit emotions that resurface. Emotions can be very, very strong, and human thoughts can be very dark and negative and bizarre and judging and all stuff. So if you've been away for that for so long, and then just re-entering that mind, which may be a perfectly normal, noisy, negative, problem-solving human mind, can be a challenge. So that is also, to me, a part of coming off the drugs, which has nothing to do with tapering. We want to, well, it does in some sense, in the sense that we want to make sure that the mind and body and emotional state that reemerges is indeed you, and not a withdrawal stage, hence the whole idea of tapering. If you just stop, you'd have no clue whether it was like your own genuine, true emotional state, or if it's withdrawal. So in that sense, it's related. But in terms of the actual challenge of coming off it, those are separate. Like coming off in terms of withdrawal and staying off, like managing life without the drug is a different thing. And a third thing would be like withdrawing from the drug is one thing, but withdrawing from, depending on what you've been told by your doctor and what information you've been getting, what narrative you've created around you as a person suffering and you taking a drug, you need to also, you could say, withdraw from the medical model or the psychiatric idea of mental illnesses and seeing it more as, and that's in the language, right? We call it pathology, illness, symptoms. This whole idea of withdrawing from that narrative and seeing whatever you're troubling with, whatever you're suffering, as a reaction to something, and then start opening the doors to seeing as a reaction to, well, what? To something. And seeing it as a reaction instead of a symptom that just occurred as a symptom of some disease. That whole narrative has to change too, especially if you want to avoid relapse, because there'll always be, and obviously there is a risk of relapse. Like the psychiatric drugs, all they do is mask symptoms, nothing else. When they work and our experience is helpful, it's because they mask some underlying condition. Not because it's not there anymore, you just don't feel it. So it makes sense that relapse, depending on how you define it, is a part of coming off the drug too. But not relapse in the sense, to me, like relapse to some underlying disease that then shows again, but rather kind of a reconnection with whatever problem was always there, if it hasn't been solved while you're on the drug.